Results of prior ACCC trend surveys, and hopefully this year as well, have led us to be able to have a discussion with the people at the top of our organization who control resources to show these are the needs that we feel at home. These are the needs that our colleagues feel across the country. Here's a case for how they add to care. Here's a case for why these are value investments.
That was Dr. Randall Oyer, Medical Director of the Oncology Program at Penn Medicine Lancaster General Health. He'll be back later in the show to discuss what's trending in cancer care and the results of a survey of cancer care professionals far and wide. What you need to know is next. Welcome to Cancer Buzz. I'm your host, Summer Johnson. For the last 10 years, ACCC has conducted an annual survey of cancer care professionals from around the nation called the Trending Now in Cancer Care Survey. The goal, to look at how cancer care delivery is evolving, the issues facing cancer programs of all types and sizes, and to give those programs tools to shape their own planning and benchmarking. Each year, the survey provides snapshots of key issues affecting cancer program sustainability and growth. You heard from Dr. Oyer earlier in the show. He's been involved with the survey for a number of years, most recently as ACCC President-elect. He tells us why these voices are needed to assess business and operational trends in delivery of cancer care.
85% of cancer care in the United States is delivered in the community. And community settings vary from small practices to medium-sized and some larger organizations. And cancer care delivery can be different in each of those locations. And it's important for each location to have a voice in what they see, what they need, and it's bringing all this information together that allows people to come up with new and creative solutions. You really have to go to the workplace to find out what solutions are needed.
In the latest edition of this survey, conducted in the fall of 2019, cancer care professionals of many disciplines from 126 organizations across the country answered questions that ranged from opportunity for cost savings to top threats to future cancer program growth.
In terms of learning from each other, we have so many members who've done programs successfully back at home in their small practices, in their large practices, in their systems. And so we look to each other to ask questions such as, how did you make sure that you had symptom management in your daily workflow? What were you able to do that made patients understand their oral chemotherapy better so that they understood the side effects and when they should call us? How were you able to provide nutritional counseling or financial navigation? We also learned from the survey that there were really no surprises. If somebody was reporting an issue from another location, you'd look at that or hear it and you'd think, I may not have put that top of my list, but boy, that's important to me as well. And so we learn we're really in this together. We're patient-focused. The same challenges that face one organization face another. They may be different priorities. We may be further down the line in terms of solving them or dedicating resources to them, but they're all important to all of us because they're important to our patients.
Next, we'll turn to Ashley Riley to help us dissect the survey results and examine what's top of mind for cancer programs. Ashley is a consultant with the Advisory Board's Oncology Roundtable, which worked to conduct and translate the survey. What were the most notable or powerful results to you this year?
I think probably the two things that stood out to me most were my favorite question that we ask every year is what are the biggest threats to future cancer program growth?
I found it interesting that drug cost fell to fifth place and reimbursement requirements is now the biggest threat.
In 2018, reimbursement requirements from payers was tied with cost of drugs for the number one most common threat to cancer program growth. The other thing I thought was very interesting from this search results is the data that we got in response to a question about what opportunities cancer programs identify for cost savings specifically for their cancer programs. So this year, we found that improving care coordination to reduce duplication and unnecessary care actually moved up from a number 4 spot in 2018 to a number 1 spot this year. I thought that was pretty interesting that we saw such a relatively large jump, honestly, in terms of opportunities for cost savings.
What were some of the new survey topics this year that you haven't pulled in the past?
We did ask 3 new questions this year that we hadn't asked in the past. So I thought that was interesting for us to get some new insights. So one of those questions, or a set of questions, was about how affected of young adult cancer. And specifically, we asked about whether or not respondents were seeing a rise in this group of cancer patients at their center. And then also, if so, what types of services they were offering, if any, to meet the unique needs of this group of patients. So we found that 29% of respondents actually reported seeing a rise in adolescent and young adult cancer patients recently. And then within that subset of respondents, 75% of them reported that they provide services to meet the unique needs of this population. And most commonly, that included psychosocial services, genetic counseling services, and fertility services. The other 2 new questions we asked were about, one was about top 5 workforce concerns. So really just, what was really top of mind for respondents, and topping the list, as maybe you all can kind of guess, was clinician burnout, with 58% of respondents reporting that as one of their top 5 concerns. And also kind of the flip side of burnout is engagement. So staff and clinician engagement came in second, with 54% of respondents ranking that as one of their top 5 workforce concerns. And that, I think, is really interesting and honestly pretty reflective of just how important employee engagement and staff engagement is in relation to performance. And we did research on this last year at the Oncology Roundtable and found ties between engagement and turnover, productivity, profitability, patient safety, patient experience. So huge impact, honestly, that engagement is having across the business. So I think interesting to see play out on the survey as well. And then the final new question that I wanted to call out was just we asked about which positions were respondents most concerned about in terms of bandwidth, and then ensuring access for patients. So really, what positions were they most concerned about in terms of capacity concerns? So medical oncologists topped the list, followed by oncology nurses, and then financial advocacy staff. So I think this is really interesting with medical oncologists. We've seen from ASCO that they've been predicting medical oncologist shortage for a while now, honestly. So interesting to see kind of that cancer programs are actually feeling that a little bit. Oncology nurses, as part of that engagement work that we did last year and some of that research, we did commonly hear from our cancer program members that they were having trouble finding oncology trained nurses. So definitely something that we've seen cancer firms get pretty creative about in terms of thinking about how they can combat that. And then finally, seeing financial advocacy staff top as well as one of those staff that are concerned about capacity for. I think this really aligns a lot in terms of, just the rising cost of cancer care. And we're just seeing more and more patients who are struggling to afford their care. And it makes sense that they're turning to financial advocacy staff. So definitely makes sense that cancer firms are feeling the burn in terms of the capacity of those financial advocacy.
I'd like to go back to cost savings. You mentioned improving care coordination almost doubled from 2018, and the other areas you mentioned were improving symptom management, utilizing lower-cost drugs through pathways, and reducing variations in care. They all seem to have a huge jump over 2018. Can you talk to these emerging trends and cost savings and perhaps shed some light on why it would change so drastically in a year, maybe from your vantage on the Oncology Roundtable?
Even though the percentage of people that rank them in their top 3, which is how we asked about, so which of the following are your cancer programs, is the biggest opportunities for cost savings, and we asked them to rank their top 3. So even though the percentages of people who ranked each of them in their top 3 changed, the actual, magnitude of the people that responded or that indicated those in response to others stayed relatively the same, if that makes sense. A much larger proportion of respondents still rank those as their top 3 compared to some of the things lower down on the list. So things like clinical staff or supplies or patient wellness. Honestly, I think a lot of that is driven by the fact that we're seeing value-based care really hold in oncology, and these are the strategies that are going to help cancer programs succeed, right? So improving care coordination to reduce duplication and unnecessary care, help programs to reduce costs. Similarly, improving symptom management to reduce avoidable ED visits and hospitalizations. That is one of the low-hanging fruits that we've seen across the board in talking to cancer programs who are participating in the oncology care model and other value-based payment models. Reducing ED visits is one of the kind of low-hanging fruits, and their biggest opportunity often to reduce costs. So it makes sense that it would pop up in this survey as well. And I think similarly, identifying and standardizing use of lower-cost drugs. We regularly see in the media, the eye-popping cost of certain cancer drugs. So I think it makes a lot of sense that is also one of the major opportunities that our cancer programs are identifying. And honestly, something that many of them haven't really been focused on until the past 5 years or so. So definitely, I think we're seeing a shift in the number of people that are recognizing not only that this is an issue, but that now is the time to address this issue, especially as the OCM wraps up and we see the new proposal from CMMI for the Oncology Care First model that might replace the OCM when it ends. It seems like value-based care is really here to stay with oncology. Similarly, with the radiation oncology advanced payment model that CMMI has proposed, it seems like this is really the future of oncology, and cancer programs need to get serious about cutting costs if they want to be successful.
Highlights from the survey can be found on ACCC's website at accc-cancer.org/trends. ACCC members have access to the full national survey report. We hope you find the survey valuable and are able to apply that knowledge to your own program.
I think one efficient way to dive into something as big and broad as this would be to take the survey back home and do your own survey, asking your colleagues and your decision makers, which items on this list do you see as our top needs for the upcoming year? I don't think any of us can do everything. We certainly can't do everything in 1 year. I think that this is helpful as a guide to say, boy, anything that you do on this list is going to help your patients. Let's look at what our top issues are, and then let's look at the survey to see what clues or cues there are to how we can start. And if we don't have a clue or a cue as to how we can start, call the ACCC because somebody's working on this. The ACCC is the how-to organization, the organization that connects us with our colleagues to say, you know what? We have somebody in Iowa or we have somebody in California who's working on that. We'll make that connection for you right away. And that's how it works. And that's a benefit for being an ACCC member.
Thank you for joining us on today's episode and supporting Cancer Buzz. If you like what you've been hearing, make sure to leave us a review. We also ask that you share this episode with a colleague. That helps us continue to create content that provides you and other listeners with current news and insights into the cancer care industry. Next time on Cancer Buzz, we'll take a look at cost-related health literacy, how the oncology team can better communicate the cost of cancer care with patients. Until then, for the entire Cancer Buzz team, I'm Summer Johnson.
Cancer Buzz is a resource of the Association of Community Cancer Centers.